Bismillahirrahmanirrahim. Quote of the day. A father gives his child nothing better than a good education by Prophet Muhammad, peace be upon him. I'm Dr. Muneeb Altaf, and today my topic of presentation is family planning. And in the family planning, we will discuss about the barrier methods and pills. Planning outcome. Planning outcome will be the types of barrier methods: male condom, female condom, the diaphragm, vaginal sponge, combined oral contraceptive pills, progesterone only pills, and emergency contraceptive pills. Now come to the barrier method. The aim of this method is to prevent live sperm from meeting the ovum. It's the physical method. In the physical method, there are the condoms, female condom, diaphragm, and the spinal sponge. In the chemical method, there are foams, tablets, and creams and jellies, suppositories, and soluble films. Condoms. Condom is an effective, simple spacing method of contraception without side effects. It prevents the semen from being deposited in the vagina. The effectiveness of a condom may be increased by using it in conjunction with a spermicidal jelly inserted into the vagina before intercourse. And the failure rate for the condom vary enormously. Survey has reported pregnancy rate varying from 2 to 3 per 100 women years to more than 14 in the typical users. Advantages of the condoms are they are easily available, safe and inexpensive, easy to use, do not require medical supervision, and no side effects, light, compact and disposable, and provide protection not only against the pregnancy but also against the STDs. Disadvantages: may accidentally break or slip off during the coitus, allergic reaction can occur, and failure rate is high. Now, the female condom is a pouch made up of polyurethane which lines the vagina. An internal ring in the end of the pouch covers the surface, and external ring remains outside the vagina. It is pre-lubricated with silicone, and spermicide needs not to be used. And it is a very effective barrier to STD infection as well. High cost and acceptability are the major problems, and the failure rate during the first year use vary from 5 to 100 women years pregnancy rate to about 21 in the typical users. Uh, the diaphragm is a shallow cup made up of synthetic rubber or plastic material. It ranges in diameter from 5 to 10 centimeter. It has flexible rim made up of spring or metal. It is held in position partly by the spring tension and partly by the vaginal muscle tone. This means for the successful use, the vaginal tone must be reasonable. Otherwise, in case of severe degree of cystocele, the rim may slip down. The diaphragm is inserted before sexual intercourse and must remain in place for not less than 6 hours after the sexual intercourse. A spermicidal jelly is always used along with the diaphragm. Diaphragm holds the spermicide over the cervix. Side effects are practically nil. The failure rate for the diaphragm with the spermicide vary between 6 to 12 per 100 women years. Advantages. Advantages of the diaphragm is the total absence of risks and medical contraindication. It's cheap and can be used repeatedly for a long time, and reduces the PID and STDs to some extent. Disadvantages. The disadvantage of the diaphragm is initially a physician or other trained person will be needed to demonstrate the technique of inserting the diaphragm into vagina and to ensure a proper fit. After delivery, it can be used only after involution of the uterus is completed. And practice at insertion, privacy for this to be carried out, and facilities for washing and storing the diaphragm precludes its use. Now the vaginal sponge. It is a small polyurethane foam sponge measuring 5 centimeter to 2.5 centimeter, saturated with the spermicide nanoxynol 9. The sponge is far less effective than the diaphragm, but it is better than nothing. Failure rate in the Paris woman is between 20 to 40 per 100 woman years, and in nulliparous woman it's about 9 to 20 per 100 woman years. Vaginal ring. A flexible ring that a woman places in her vagina continuously releases two hormones, progesterone and estrogen, like the natural hormone progesterone and estrogen in the woman's body from inside the ring. Hormones are absorbed through the walls of vagina directly into the bloodstream. She leaves the ring in place for 3 weeks, then remove it for the fourth week. During this fourth week, the woman will have the monthly bleeding, and this vaginal ring is also called the Nova ring, and it works primarily by preventing the release of eggs from ovaries, which is the ovulation process. Now, the chemical methods, which are spermicides. The spermicides contain a base into which a spermicide is incorporated. The commonly used modern spermicides are surface active antigens, agents which attach themselves to spermatozoa and inhibit the oxygen uptake and kill the sperm. The spermicide should be free from potential systemic toxicity. It should not have an inflammatory or carcinogenic effect on the vaginal skin or cervix. No spermicide which is safe to use has yet been found to be really effective in preventing the pregnancy when used alone. Spermicides are not recommended by professional advisor, and they are best used in conjunction with the barrier methods. Disadvantages of the spermicides, they have a high failure rate. They must be used almost immediately before intercourse and repeated before every intercourse, and they must be introduced into those regions of the vagina where sperms are likely to be deposited, and they may cause mild burning and irritation. Now come to the oral pills. Combined pills, progestin only pill, post-coital pill, and once a month pill. Combined pill. They contain both estrogen and progesterone. Combination birth control pill prevent ovaries from releasing an egg. They also causes changing in cervical mucus and the lining of uterus, which is endometrium, to keep the sperms from joining the egg. Advantages. Combination birth control pills are a reliable form of contraception that's easily reversed. Fertility can return to the normal almost immediately after stopping the pill. Other non-contraceptive benefits of these pills are these pills also decreases the risk of ovarian and endometrial cancer, ectopic pregnancy, ovarian cyst, benign breast disease, and it improves the acne, less severe menstrual cramp, and reduction in the androgen production caused by the polycystic ovary syndrome, reduction in heavy menstrual bleeding due to uterine fibroid and other causes, as well as reduction in related iron deficiency anemia, relief from premenstrual syndrome, shorter, lighter, and more predictable period for certain types of combination pill, fewer periods yearly, and better control of monthly cycle and reduction in hot flashes for the woman nearing the menopause. Combination pills are categorized based on whether the dose of hormone stays the same or varies. Monophasic are each active pill contain the same amount of estrogen and progesterone. Biphasic active pill contain two combination of estrogen and progesterone. And triphasic are the active pill contains three combinations of estrogen and progesterone. In some type, the progesterone content increases. In other, the progesterone remains steady and estrogen content increases. The choices of the oral contraceptive pill. The conventional regime is 21 days of active pill and 7 days of placebo. Provide the predictable message because monophasic oral contraceptive pill may be easier to take, easier to identify and manage the side effects, and it is easier to manipulate to alter the timing of the menstrual cycle. They are preferred over the conventional biphasic or triphasic OCs. Extended cycle or a contraceptive either eliminate the menstrual cycle or results in only 4 menstrual cycles per year, and they may be associated with less dysmenorrhea and the menstrual migraines. Commercially available extended cycle OCs are available or monophasic 28 days of oral contraceptive can be cycled by skipping the 7 days placebo phase for 2 to 3 cycles, sometimes refers to as bicycling or tricycling. Now, the contraindication of the oral contraceptive pill. You should not use the pill if you are pregnant or breastfeeding a baby which is less than 6 months. You smoke a cigarette and more than 35 year of age, and ever had breast cancer, and if I had a liver or gallbladder disease, have been told by a doctor that the female has a lupus, so she should not take the OCP. And if a woman has given birth in the last 3 weeks, she should not take the pill. If she has a high blood pressure, severe headache, high blood clots in the legs or lungs, have a stroke or heart disease, or have the diabetes, they should not take the oral contraceptive pills. So these are absolute and relative indication against the thrombophlebitis or thromboembolic disorder, cardiovascular disorder, carcinomas of breast, undiagnosed abnormal genital bleeding, suspected pregnancy, benign or malignant liver tumor, cholestatic jaundice, hepatic neoplasia, hypersensitivity to OCPs or pregnancies. These are the absolute contraindication, and relative are if the age is more than 45, the patient is diabetic, hypertensive, smoker, having a gallbladder disease, history of gestational cholestasis, history of renal disease, impaired renal function, hyperlipidemia, varicose veins, and superficial venous thrombosis, history of migraine with a focal aura, and major surgery with prolonged immobilization. So these are the relative contraindication of oral contraceptive pills. So the risk of conception after taking the oral contraceptive pills, an estimated of 9 out of 100 women taking combination birth control pill will get pregnant in first year of use. With perfect use as directed, the pregnancy rate is less than 1 in 100 women each year. Now, the possible side effects. If a woman chooses this method, she may have some side effects. Usually, they are not usually signs of illness. Most common are the nausea and stomach upset, changes in the bleeding pattern, lighter, irregular, infrequent, or monthly bleeding, and mood changes or headache, tender breast, dizziness, or slight weight gain or loss. Now come to the progesterone only pill. This pill is commonly referred to as mini pill or micro pill. It contains only progesterone, which is given in small doses throughout the cycle. And the commonly used progestin are norethistérone and levonorgestrel. The progestin only pill never gained widespread use because of poor cycle control and an increased pregnancy rate. Progesterone only pill. Indication are it can be used for any woman seeking reliable, reversible, quietly independent method of contraception in the absence of contraindication. Women with the contraindication to estrogen can take the progesterone only pill. Women more than 35 years of age who smokes can take this progesterone only pill. Women having migraine, headache, and neurological symptoms, women who have unwanted side effects of COCPs, and breastfeeding women can take the progesterone only pills for contraception. Side effects of the Progesterone-only pills are the headache, breast tenderness, acne or hirsutism, nausea, and spotting. Contraindication are known as suspected pregnancy, genital bleeding of unknown etiology, liver tumor, or acute liver disease. Failure rate of the progesterone only pill, it is estimated that as many as 13 out of 100 women who uses the mini pill will get pregnant in a year of use. Now come to the emergency contraception. And emergency contraception is a form of birth control used to help prevent a pregnancy from happening after having unprotected intercourse. Pregnancy can occur if a woman forgets to take her birth control pill, or if a condom breaks, or no contraception is used. Emergency contraception can also be used in the woman who has been raped. Postcoital contraception. Postcoital contraception is recommended within 72 hours of an unprotected intercourse. Two methods are available. IUD, the simplest technique is to insert an IUD if acceptable, especially a copper device, within 5 days. And the second one is hormonal. More often, a hormonal method may be preferably levonorgestrel 0.75 mg tablet is approved for emergency contraception. It is used as one tablet of 0.75 mg within 72 hours of unprotected sex, and second tablet after 12 hours of the first dose, or two oral contraceptive pills containing 50 mg of ethinyl estradiol within 72 hours after the intercourse, and the same dose after 12 hours. The four oral contraceptive pill containing 30 to 35 mcg of ethinyl estradiol within 72 hours, and four tablets after the 12 hours, or mifepristone 10 mg once within 72 hours. So the emergency contraceptive pill effectiveness will be one pill when taken within 24 hours will offer protection of 75 mg, 75%, sorry, 95%. And if the pill is taken between 25 to 48 hours, it will provide protection of 85%. And if it's taken 49 to 72 hours after the intercourse, it will provide contraception protection of 58%. Emergency contraception can prevent up to over 95% of pregnancy when taken within 5 days after the intercourse. The emergency contraceptive pill regime recommended by WHO are alipristal acetate, levonorgestrel, or combined oral contraceptive pill consisting of ethinyl estradiol plus levonorgestrel. So the effectiveness of to understand the effectiveness of emergency contraceptive pills, if 100 women each had unprotected sex once during the second or third week of menstrual cycle, if they will not take any contraception, emergency contraceptive pill, 8 among them will get pregnant. And taking the alipristal acetate, less than one will get pregnant. And taking the progestin only emergency contraceptive pill, one will get pregnant. And taking the combined estrogen progestin emergency contraceptive pill, two among these 100 women will get pregnant. Emergency contraception indication: intercourse within post 72 hours without contraceptive protection, independent of time in the menstrual cycle. And contraceptive measure, barrier method, dislodgement and expulsion of IUD, missed oral contraceptive pill, sexual assault, exposure to teratogen or cytotoxic drug. Common side effects of emergency contraceptive pill are the changes in bleeding pattern, including slight irregular bleeding for 1 to 2 days after taking ECP, or monthly bleeding that starts earlier or later than expected. The abdominal pain, feeling sick, and tiredness. Now come to the recent updates. Emergency contraception, according to a WHO, can prevent about up to over 95% of pregnancy when taken within 5 days after intercourse. And EC can be used in the following situation: unprotected intercourse and possible contraception failure, incorrect use of contraception. Methods of emergency contraception are, and there are four methods of emergency contraception. These are the ECP containing allopurinol acetate, ECP containing levonorgestrel, combined oral contraceptive pill, and copper-bearing IUD uh, devices, and emergency contraceptive pill and combined oral contraceptive pill. The emergency contraceptive pill with allopurinol acetate taken as a single dose of 30 mg. Uh, Emergency contraceptive pill with the levonorgestrel taken as a single dose of 1.5 mg. All are alternatively taken in two doses of 0.75 mg, 12 hours apart. And the combined oral contraceptive taken as a split dose, one dose of 100 microgram of ethinyl estradiol plus 0.50 mg of levonorgestrel, followed by the second dose of 100 microgram of ethinyl estradiol plus 0.5 mg of the levonorgestrel 12 hours later. So, effectiveness shows that the meta-analysis of two studies showed that women who used emergency contraceptive pills with allopurinol acetate had a pregnancy rate of 1.2%, and studies has shown that ECP with levonorgestrel has a pregnancy rate of 1.2 to 2.1%. Ideally, ECP with allopurinol acetate and ECP with levonorgestrel or combined oral contraception should be taken as early as possible after the unprotected the intercourse within 124 hours. Uh, 120 hours. Emergency contraceptive pills with UPA are more effective between 72 to 120 hours after the unprotected intercourse than other ECPs. So the National Cancer Institute shows these articles showing that the relation between the oral contraceptives and the cancer risks. In this, we can see that the breast cancer analysis of the data from more than 150,000 women who participated in 51 epidemiological surveys showed that overall women had ever used oral contraceptive had a slight 7% increase in relative risk of breast cancer compared with a woman who had never used oral contraceptive pills. And again, the woman who has used contraceptive for 5 or more years have a higher risk of cervical cancer than the women who have never used oral contraceptive. In the endometrial cancer, women who ever used oral contraceptive have a lower risk of endometrial cancer than the women who have never used it. And again, the women who are using the oral contraceptive has 30 to 50% low risk of ovarian cancer than who have never used it. Uh, how could the oral contraceptive influence the cancer? Naturally occurring estrogen progesterone stimulate the development and growth of some cancer that express receptor for these hormones, such as breast cancer. Because birth control pill contain the synthetic version of these female hormones, they can potentially increase the cancer risk. Once a month birth control pill. This is the article which are published in 2019. Researchers have developed a once a month oral contraceptive pill that they say would offer the woman more choices and control over the fertility. Once swallowed, the pill remains in the stomach for weeks and slowly releasing the hormone to prevent the pregnancy. Once a month birth control is embedded into starfish-like organic device packed into a capsule that can be swallowed. According to study, once the capsule reaches the stomach, it dissolves and releases the starfish contraction, which then extend out its six arm, gets lodged in a place and slowly deliver the hormone. In United States, 12.6% of the women use an oral contraceptive pill, according to CDC. But failure to take the pill at the same time every day or forgetting to take the pill can increase the risk of pregnancy. Now it's time to the MCQs. MCQ number one. A young couple visits family planning center to seek the best option for contraception as a male partner is recently diagnosed with the HIV. Which of the following contraceptive device provide best protection against the transmission of HIV? A is the male condom, B is the female condom, C is the diaphragm, D is the vaginal sponge, E is the IUCD.
Alpha.
Yes, alpha is the answer. Male condom will provide the best protection against the transmission of HIV. Question number two. A 30-year-old lady wants to take the OCP for participating after having two kids, but she is worrisome about the side effects associated with them, for which she needs counseling. Which of the following is the side effects? OCP increases the risk of infertility when stopped. Women need to take a rest as they build up in the body. The OCP increases the chances of breast cancer. They can cause multiple births or they can cause premature births.
Beta.
Uh,
Charlie.
yeah, C is the answer. The OCP increases the chances of breast cancer by about 7%. Question number three, a researcher want to study on combined oral contraceptive pill by doing RCT. Which of the following women can be taken for research purposes? Women with the scabies, elderly woman who smokes excessively, woman with the DVT, woman with the family history of breast cancer, woman who is pregnant.
Elephant or Delta.
The answer is alpha,
A
because
lady.
yes, because all the rest of the options are the contraindication of OCP. So the alpha is the answer. Women with the scabies can be taken for the RCT to take the pills. Question number four. A young lady using combined oral contraceptive pills as a contraception for last 1 year presented to the OPD for nausea and pain epigastrium. Considering the history, which of the following condition could aggravate by combined oral contraceptive pill? A is appendicitis, B is cholecystitis, C is CA gallbladder, D is stomach upset, E is pancreatitis.
D. Delta.
Yes, delta is the answer. Due to the COCPs, the stomach upset will get aggravated. Question number five. A 36-year-old female delivered her third baby. She is breastfeeding her child, so she wants to get the contraceptive method for short term that do not affect her breastfeeding. What could be the best option for her? A is combined oral contraceptive pill. B is progestin only pill. C is emergency contraceptive pill. D is combined with vaginal ring. E is IUCD.
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 So as you can see in the stem of the question that the contraception is for the short term. So here the answer will be beta. Progesterone only pill is safe in the breastfeeding mother. Question number six. 100 women had intercourse once during the second or third week of menstrual cycle. Which of the following is not true regarding the effectiveness of the emergency contraceptive pills? So, 8 pregnancies with no ECP, uh, more than one pregnancy with alipristal acetate, one pregnancy with progesterone only ECP, and two pregnancy with combined estrogen and progesterone emergency contraceptive pill.
A.
No, its
Charlie?
answer is B. With the use of alipristal acetate, there will be less than one pregnancy. Uh, that's why the answer is B, which is not true regarding the effectiveness of ECPs. Question number 7. Contraceptive vaginal ring are a good contraception as they do not require skilled providers and self-administer and show a higher stability of drug diffusion. Which of the following is true about them? Need to be placed for 3 months, then destroyed, provide protection against STDs, provide protection against vaginal infection, provide protection against pregnancy as the COCPs do, and provide protection against ovarian cancer.
Beta?
D.
Yes, delta is the answer. It provides protection against pregnancy as the oral contraceptive pills. Question number 8. The combined oral contraceptive pill, beside being used as a method of contraception, can be used to treat the following except endometriosis, ovulation pain, menorrhagia, dysmenorrhea, and E is ovarian cyst.
E.
E. C.
Yes, OCPs can be used for the treatment in the ovarian cyst. Question number 9. Combined oral contraception, also called the pill, low dose combined pills, work primarily by preventing the release of eggs from the ovaries. Which of the following is true regarding the risk of cancer associated with them? Reduces the risk of endometrial cancer, increases the risk of ovarian cancer, reduces the risk of breast cancer, and reduces the risk of cervical cancer, and worsen the endometriosis as it contains estrogen.
E.
C.
The answer is A. It reduces the risk of endometrial cancer. Question number 10. The mechanism of a contraceptive pill include all of the following except ovulation suppression, enhanced ovarian androgen production, altered cervical mucus, altered endometrium, and altered tubal motility.
B.
Beta?
Beta is the answer. This is the key, and thank you.
Okay, thank you very much, Dr. Muneeb. Very nice presentation. Very important concepts have been presented. And the best part is the MCQs because all your slides are very well covered MCQs, especially when you are talking about the different cancer that are associated with either oral contraceptive pills or with progesterone and other types of emergency contraceptives. You have beautifully covered each aspect. Thank you very much and very best of luck.
Thank you.
Thank you, madam.